Well, hello everyone, and welcome to today's webinar. Today we'll dive into a very exciting topic, Excellence Council Perspectives, from Burnout to System Redesign in Healthcare 2026. This session is eligible for HRCI, SHRM, and ATD professional development credits. Before we dive into today's content, let me tell you about Breton Hall Group and some incredible opportunities that could accelerate your career. Breton Hall Group is a leading professional development firm that has been serving learning, talent, and HR executives worldwide for more than 30 years. We've advanced the growth and performance of millions of employees and leaders through our cloud-based platform, delivering evidence-based research, data, and certification programs that empower organizations to achieve excellence in every area of human capital management. Our impact spans more than 10 million employees and executives globally, supported by our comprehensive research library, strategic insights, and prestigious awards program. Below is a sample of the organizations we are proud to partner with. We have incredible learning and networking opportunities, our two BRIC events happening this year, our AI Summit on October 15th, and our Leadership Summit on November 17th and 18th. And don't forget to save the date for next year's 2027 HCM Excellence Conference happening January 26th through 28th. All details for everything I've mentioned will be available in a PDF you'll receive within 24 hours after this webinar. Now, based off everything I just went over, I would like to know what you would like to learn more about. Is it our institute, our awards program, the 2027 HCM Excellence Conference, or maybe it's one of our BRIC summits? I will leave this up for just a few more seconds. All right, thank you. And now just a few quick things to note. If you have any questions during the webinar, please use the questions panel on your control bar. We'll be answering them throughout the session. We're also recording today's webinar, and you'll receive an email within 24 hours with the link to the recording and the PDF of the slides. The chat box is open, so feel free to share your thoughts as we go along. Your input makes this more valuable for everyone. Now I'd like to pass things off to David Forey.
Wonderful, Ivy. Thank you so much for going through those items. And we certainly hope that you will drop some items into the chat. We will be pleased to answer as many questions as we can get to. This session is going to be interactive. It's not slide heavy at all. So we certainly want to hear from you all and answer as many questions as we can. As Ivy mentioned, my name is David Forey. I'm a Senior Vice President here at Breton Hall Group. One of the privileges I have is to partner up with our Excellence Council members. And on the call today, we have 3 Excellence Council members, and I thought it would be great if you could each introduce yourself rather than me reading your lengthy bios. And I think you can all call out some of the pertinent details for today's conversation. Kithri, let's go left to right on this one. Why don't you get us started?
Sure, thanks. Kithri Silva. I've been in learning and development for more than 25 years. Started out in higher education and been in healthcare for most of that time, really working to drive workforce capabilities and performance, really wanting to understand the cross-section between learning and, helping the business to drive their metrics and deliver measurable results for the business.
Thank you, Kithri. Lisa?
Hi, everybody. I'm Lisa Colicchio. I lead the HR team at WCG Clinical. Probably not a household name, but we work extensively within the pharmaceutical and life sciences industries to help clinical trials run better and more effectively. And our team supports the gamut of the expected activities to ensure that our workforce is performing well. We have the right talent in the right roles at the right time today, tomorrow, in the future, and that they're always focused on the right things.
Perfect. Thank you, Lisa. Amanda?
Hi, good morning. Amanda Hogan here, Vice President of Enterprise Talent and Culture at OU Health in Oklahoma City. We are the only academic medical system here in the state. So I lead the entire life cycle, really driving the people and culture strategy to ensure that we're always making sure we're connected to really hiring top talent, retaining top talent, developing them, and continuing to advance this for our people to be able to treat our patients tremendously better. Thank you for having me.
Thank you all for being here, and thank you to the audience for tuning in. So the basis of this conversation is around a report that the Excellence Council contributed to. There is a link that just got dropped into the chat. If you have not downloaded it, feel free to download this book. You can see on the bottom that we have 3 of these professionals on the call today, and there's additional 3 more professionals on the Excellence Council that contributed to the research. And what we did is we looked at trends happening not only with the 6 of them, but across all of the healthcare the healthcare industry, looking at external research as well as our award submissions. For those of you who submitted awards, we were looking at some of those trends of things that we're tackling within healthcare. So, of course, a big call out was addressing burnout. So that is where we got the name for today's webinar. But there's several different trends that we looked at and some research that backed it up, as well as great articles by the 6 Excellence Council professionals that you see on the cover of the book. So please download that. Make sure you have a look. But today's conversation, we really wanted to make it conversational and talk about some of the themes. And the first one that we saw is that many workforce challenges in healthcare are no longer episodic. And I want to ask Amanda, how does that reflect what you're thinking about as far as workforce strategy today?
I think that's actually right on target. We have shifted from really treating our workforce challenges as moments in time to starting to recognize them as a constant operation condition that we need to consistently always think about. Making sure that we're focusing on shortages, burnout, competition, and that these are no longer just cycles, that they're becoming structural things within our industry that we really need to focus on. So we started focusing on changing our strategy to be more system thinking and have a design rather than reactionary. And we all know in healthcare, you can have a tendency because you're moving so fast and so many things are going to react, but really thinking ahead of what is our strategy around how are we building pipelines and not just focusing on hiring plans and hiring talent fast, but what's the quality of the hire? What's the early age that we start? In at OU Health, we've even really started to go out into the community and start to touch the middle schoolers and really interact with them at an earlier age, bringing them into our systems as explorers and letting them see what that is, because you have to think about it differently. What do our retention strategies look like? Because we can't just keep doing recruitment campaigns and hiring without on the other end looking at how are people feeling? Are they feeling included? Are they having a sense of belonging? And then the key piece that we've really heavily started to look at is workforce planning, and how are we aligning our workforce planning here at OU Health to access and growth. So really it's a strategic shift in how we're thinking about it. It's no longer about just solving for today. It's really about designing a workforce that can sustain for tomorrow.
That Amanda, extremely well said. Lisa, I'd love to hear your thoughts on that question as well.
I agree with everything Amanda said. Some of the things that we are trying to look at is what is the new normal, and that's kind of almost an oxymoron, because just when we think we know what it is, it changes. But one of the things especially for HR professionals, is staying just very close to the business rhythms. Where is it today? Where is it expected to go? Because unfortunately, you have to design for now, but also think about the future. So we're doing a lot of the same things that you're doing as well, Amanda, but wholeheartedly agree. It's no longer episodic. I think the best advice that I can offer is be in constant communication with your business leaders to understand how the business is evolving, because they're looking to us for the people solutions. And so the more we have time to be aware, research, network, benchmark, experiment, and be thoughtful, the better solutions we can bring to the table as these developments unfold before us.
And Kithri would like, if you could round us out on this question.
Sure. Again, I think it's all about that strategy. So understanding where the business is expecting to go. And then, from a learning perspective, how do we prepare people to execute on those strategies? If we have, good career ladders in place and we understand what are the skills and things that may help drive those strategies, we can start trying to prepare them for those. And it's not just a temporary thing. It's how do we design learning that's more, and I know we've talked about this forever, but it needs to be more embedded in the workplace and understanding, really from a learning perspective, how do those skills and those competencies show up in the workplace where they're, those core clinical capabilities that we're trying to support, understanding the rigor and all that's involved in that, but setting it up in a way that um, it's designed for the way people perform, and they can do that safely and sustainably, and also, work towards those strategies. So the challenges are, ever present, but the support and the way that we support them and directing them to those skill sets needed for the strategy, I think is how we sustain it.
Absolutely. I know another area that's, really comes down to workforce strategy is the idea of burnout. And that's a big thing that came up in our research. And to be quite frank, coming from outside the industry, I did not know there was such a big burnout in the culture of healthcare. Obviously, when COVID hit, we heard a lot about it. It was in the news, and a lot of people, a lot of organizations lost healthcare professionals afterwards because they just were completely burned out and they left the industry altogether. So that's when I started to pay attention. But even in talking to the three of you, as well as others, it's long before that. It's really baked into how this industry is put together. So it's not really just a wellness issue, which some industries, would say burnout is okay, engagement, wellness. We can figure our way out of it. But how do we think about it from a higher level? Lisa, would love to hear what you and your organization are thinking about.
Thank you, David. I feel strongly about this one. As you know, I was delighted to see that this made the list in our research and report. Burnout to me it's an outcome and it's a symptom of something that's happening before it. And what I've seen all too often is we treat the symptoms. You get a rash, here, put this cream on it. And the rash goes away, and you never really know why you had the rash, but it went away until it's back. And burnout is kind of like that. So for me, one of the things that I spent a lot of time talking to our business leaders about is prioritization. We can't do everything. We shouldn't do everything. And most importantly, are we clear on what we should be doing? And do we stay true to that? I think many organizations, ours included at times, falls prey to what's the next big thing? What's the shiny metal thing? Oh, the competition's doing this. We've got to do this. And so I spend a lot of time trying to really anchor people to what is it we're trying to achieve? Are the goals clear? And everything we do should ladder up to those goals. I always tell my team this. We have HR goals that ladder up to the organization goals. And I always tell my team, if you are working on something and you cannot articulate how it contributes to driving this bigger goal, please call me because I'll tell you to either stop or we'll outsource it. Or if it's a compliance issue, I get it. But I think just understanding first and foremost what the goals are and then organizing the work around it and then looking at what is the work? What is the work? What is the workload? And making sure that everybody is being pretty ruthless in how they prioritize because I think we've all just in many ways learned to just suck it up. It comes with the territory. And your point, David, it exploded in public consciousness with COVID. Not a good thing, but in some ways a good thing because it's finally getting the attention that it deserves in today's workforces. And of course, we do wellness things. We have wellness weeks, we have activities. There are things you can do to help with when you're in the acute burnout. But systemically, you've got to solve it from where it's starting. And I see in every company I've worked for, there's so many great ideas. You can't do all of them. be really clear on what your priorities are, make sure everyone is aligned, and use that as your filter by which you define the work for yourself and your team. Push back, defer, automate. We're going to talk a little bit about some of those other things. But to me, that's at the very beginning stages before you ever get to the symptoms of burnout. If your organization does not have clear goals and they don't talk about them, you just wind up wherever you go and you're burning out a lot of people in the process.
That's a great analogy with the rash and trying to figure out the symptoms, Lisa, and very true to the conversation today. Kithri would love to hear how burnout and redesign is looking within Cardinal Health.
Yeah, I think one of the things that we frequently talk about is helping folks to work at the top of their license or in their, scope of practice. So that, we want to make sure though, if we're expecting all the way from our support staff all the way up to, our physicians and our leaders to be functioning at that level, how do we design the work such that that's possible? So in learning often, we talk about cognitive load. And I think that's a lot of what's happening in the workplace is that they're expected to be functioning at a level that, and for lengths of time that are just not sustainable. So as we think about redesigning the roles and the way people operate, are we helping them to operate at the right skill level for where they're at? How do we, think about the administrative burden and some of the maybe misaligned tasks that folks are having to deal with? And so how do we equip them along the way to function at the right level with the right supports and the systems are in place? So it's not just about those one-time events where we can come in and have wellness support. It's about how do we design the daily work so that it's sustainable and people can see career paths and advancement, and they can move through those levels and they're supported along the way.
Great points. Amanda?
So I think the one thing that we've really done is focus on listening. In this way of redesigning work, we've understood that it's not a wellness program that will fix the burnout alone, but it's really about span of control. When we review span of control within our system, we're saying, hey, we got some work to do. It's about scheduling. We're really focusing this year, and as we go into our new fiscal year, is how are we really optimizing the scheduling, not only for our nurses, but for our physicians and for all team members, to really be able to not only really provide that access to those patients at all times necessary for us to really provide it where it's us catering to the patient, but what are we doing also to ensure that we're properly staffed, we have the proper operational plan, and we're really making sure that we have leadership capability. So what we did through that is really started to look at how we structured the work so that people can succeed rather than fail. And what that starts with also is rounding. So what we have is we put a rounding strategy in where our executive leaders every Tuesday, they round all over the entire system and they go to different units and they talk to them and they listen. And then when they come back from that rounding, it's actionable feedback that then is cascaded to the actual leaders of the units to begin to address and fix. So what we were seeing is now we heard you. We heard that these are the operational structural things that we need to adjust. Let's go fix some of these areas and the small wins. And we not only do it from the executive level, all leaders in our system are encouraged to round on a regular basis. And yes, we have the formal processes that you go through, but really it's about that informality that really once you go connect with people, what we were finding is some of our leaders were like, people were upset and frustrated because they wanted a chair. And once we got them the chair, that made them happy to do their job. And so it's the small things are if you just tweak a operational schedule and say, hey, you can come in from this time to this time, then you give them the relief to begin to actually have that work-life integration, which is what they truly are wanting, and they want to be successful. So how do we meet them in the middle to really hear them and take action on that feedback? And that's helped us.
Absolutely. And some of those little things like getting a chair can go a long way into, that person's life and their daily workload and really change quite a lot. And it might be something that they're too afraid to ask for. or say anything. There might have been a policy that says, we don't want you sitting, we want you standing, to appear more approachable or something like that, and not realizing the implications that has on the person. So really wonderful. And it looks like we've got a couple of questions coming in. I think more so some comments. So one is the need for the hour. The need of the hour is to shift away from treating burnout as a wellness problem and focused on redesigning work, break roles into critical, observable skills, and move work to the right skill level, reducing unnecessary escalation and rework. So thank you for that feedback, Krishna. So I think that kind of plays in well with something I definitely want to hear your feedback from, Kithri, as a L&D leader, as there's a shift from tracking training to validating competence. How are you approaching this, especially as a very clinical and regulated environment at Cardinal Health?
Right. We have folks who join the organization who are licensed and credentialed and, come in with a certain level of competence. But how do we, have evidence of that? And it's not just going in and taking, written assessments and checking the box. We need to observe those things in the workplace. But how do we make it such that, obviously in busy clinics, it's very difficult to pull people out of the normal workflow. So how can we embed it and, make it part of the systems in which they're already working in? It's on a cadence where it's regular, it's expected, but it's in, bite-sized pieces so that we can observe frequently, that they're able to perform under real conditions and provide that evidence of those critical tasks that they're performing. And also that we can capture that in a way that allows us to be confident that the folks that we have in place do have those competencies. So how can we report out on that? So that we can get to things faster too. So if we see any trends or we need to, adapt something in some way, we're able to gather that data and make those changes. I think the way we're trying to approach it is they're already in these systems on a regular basis. How do we design competency checks and observable assessments throughout and put them on a cadence so that we know that they're happening. We know that they're happening at the different levels and that our observers are supported in that as well as the observed.
Great feedback and insights. Amanda, I'm curious, OU, is that a teaching hospital? And is it different in an organization that is more teaching focused than maybe other organizations?
So I think that's a great question. And I think as the academic medical system, we have to live into our tripartite mission, which is research, education, and really, making sure that people are living into providing that top quality patient care. And the way that we do that is we have to look at completion of training does not equal competence. So when you're thinking through that level, it's like what you're saying is no longer it's just a check off the box. It's really how are we validating the skills? How are we observing their performance? How are we redesigning and thinking about our training? How are we looking at what types of courses and reaching the audiences that we reach? Oftentimes, I think people will think it's just training is like a one, size fits all approach, but you really have to redefine and for all of the different roles that we have and all of the different pathways that we have. And I think that's what we've really begun to lean in as we've built job architecture is what do those development pathways look like within each one of those areas of opportunity for people to actually see a success. And while they're going into our higher level roles, they're equipped, which then once they reach that leadership level, they have the skills and the capabilities. So what we did in our system is we built competencies that are universal across the entire organization that we measure in our performance, that really equips people with those people leader skills that align to our values, but you have your technical skills also for the role that you have to live into. So really we're trying to align learning to performance, that equals outcomes, so that then we can actually see what you're saying. Those physician residents actually want to stay within our culture because they've not only got that competence level of training around their interpersonal skills and their leadership, but they're also getting trained on that with that research and that skill that they need specifically to actually practice and professionally practice. The same thing with nursing, imaging, and all of that. And I think one thing we're doing with workforce development is we're starting early so that when they come into our system, they already know the culture and they already know that we're 100% bought into making sure they're developed.
Thank you. Lisa, from a CHRO perspective, are you looking at things a little bit differently or similarly?
Similarly, I would also add an and to this. One of the things we are trying to focus on, and particularly with our people leaders when they're giving coaching or they're having conversations with their employees who've just gone through a learning experience, is walk me through your thinking. Because to your point, Amanda, right, I can tell you what the answer is of 1,000 divided by 26. But do you know how to do the longhand math? I'm probably dating myself. Does anybody remember doing the division with paper and pencil? There was such a time, folks, when we did that. And it's the equivalent of show me the work, show me your thinking. Why did you choose left versus right or pink versus blue? So it goes back to what Amanda and Kithri were saying. We want people to learn the content. We want them to add new skills to their portfolio. We want them to use those skills, but it's not as linear as take class and I know how to do this. So we feel one of the keys is really having managers engage with employees. Talk to me about how you're using this. You just went through this experience. Where have you incorporated it? It shouldn't be an add-on. It should be part of how you work. And so we're really leaning on managers, teaching them to have those inquisitive conversations, the essentially show me the work, how you got here, which reinforces what Kithri said. We want everybody to practice at the top of their license, and critical thinking and showing the work we see as key to part of that, achieving that.
All great perspectives. And we had one more submission in the chat, which is more a statement which I really liked. There's a need to be more deliberate about moving from hours completed to ability demonstrated, especially in the regulated environment where risk tolerance is low. The question we probably need to anchor on is, can this person perform the critical task under real conditions with acceptable variance?
I love that. I love that, David. And I think one of the, when we ask the managers to quote, show me the work, is if your defined process or the way it is supposed to happen is X, but you throw in Q and you throw in D, walk me through your thinking. How are you going to pivot, readjust? How do you get to an answer when things don't exactly fit what you've been taught? And that's where we see the critical thinking and the ability to reason and contextualize circumstances to come up with the best answer you can. Let's face it, sometimes we don't have all the inputs we need. So I think this person hit it spot on. It's not just here's the playbook and it works this way every time. I think in all 4 of our lives on this call, it doesn't. And I'm sure for all the participants as well.
Sure. And a great reminder, please drop your questions in the chat. We love to hear from the audience, and questions and comments. We want all of them. Amanda, I'm going to serve this next one up to you, and it's something that we saw across every industry, everybody that we talk to, any event that you go to, conversations certainly about AI. But as it's becoming more embedded within healthcare, how are you thinking about it as a clinical change rather than just a technology implementation?
Yeah, I think this is the hot topic now. It's interesting when you go to conferences, you see AI, even when you're in with different vendors, they're telling you about all the new AI tools that you can benefit from. So I think it's really where all organizations, whether in healthcare or, in other industries, are having to think about it. But specifically for us, we have to think about it as a workforce transformation. So really thinking about how is AI going to contribute and help us with the clinical workflows, with our decision making to make it faster, to make it more effective. Really thinking through, is it going to enhance like the work that we're doing and how do we skill our team members, which we're working towards that now, to really utilize some of the areas of AI that we have within our system? Are we really letting it help us with time allocation, especially for talent acquisition? I inherited a team that had no AI, no technology. They were manually reading resumes, and we was like, we got to fix this. So even implementing that has made my recruitment team more effective in how we hire. It takes the time off of them for the small things of scheduling and doing things like that. And now they're able to actually truly source, really focus on the quality of hire. So when you're looking at different areas of opportunity like that, and then you're looking in the clinical space, how is it allowing us to effectively really treat our patients and give them the best experience while they're in our care? So the real work now with AI, I think in healthcare, is preparing our leaders to be equipped on how to use it, to understand it, to know that it's not something that's going to take away, because I think there's a big fear of it if you implement it too much, that it's not going to take the role away. It's really just going to enhance your role, especially in healthcare. It's going to redesign how we think about roles. And we have to start to create where people build that trust with the organization and know this is to help us so that they can adopt the behavior and not just think it's a deployment or being done to them. So I think it's really around how we're thinking about the roles, how we're thinking about AI, and how we're shaping the story around the transformation so that we can really truly see and enhance our organization, because that's where we're trending and that's where everyone is having to really upskill. And it's in every area of my life cycle that I am having to look at it, from the talent development space, the talent acquisition space. How are we retaining? How are we even using engagement tools? It's a consistent theme that I'm starting to see across the entire life cycle.
Yeah, when we looked at talent, when we looked at healthcare, the first place we saw AI appear was certainly on that talent acquisition side because of high volume hiring or that constant need to intake more professionals. So that is certainly where we saw things start, and it sounds like your organization's thinking further along, which is wonderful that you're further along the progression, and really thinking about how it applies to everyday work and, not just siloed into one department.
Yeah.
Lisa, can you share how your organization is working within AI?
Yeah, so I would say that WCG is currently in the process of moving from experimentation to adaptation. We are trying to be very thoughtful. The last couple of months, we've made the tools available. We're a Microsoft shop, so we use Copilot is the official approved internal tool. And what we have found is we've had 3 different cohorts of employees when it comes to AI. The early adopters, people have had their own Claude accounts for 2 years. They're very adept at using it. You have the people on the other end who are just saying, this too shall pass. If I just kind of duck, it'll fly over. But we have a large group of people in the middle saying, I want to do this and I believe there can be benefit, but I'm just not sure what I should be doing. So we're spending a lot of time being very thoughtful. We've developed a change plan that includes the usual things like training, office hours. We have a champions network, and we actually started a Teams channel. And the Teams channel is where people can put in their success stories. They cut and paste prompts that have worked really well for them to develop either shortcuts or more effective ways of doing something. We've also asked our executive team, my peers on the leadership team, to talk about how we use it. Because I don't know if others have heard this, but one of the things we have heard from employees is they're almost afraid to use it because they feel like it's cheating, or I'm using something to come up with the answer. So what value do I add to it? And so we've really asked folks to share stories of how AI can give you a great first draft, but this is where, per my prior comments, critical thinking, show me the work. You design the prompts. AI doesn't design its own prompts. So you have to interact with it. You do the thinking. What am I looking for it to do? What do I want it to look like on the other side? How do I refine the output? So we're slowly but surely trying to get employees more acclimated in becoming confident in how the tool can be basically a digital assistant and a partner, and sharing those success stories. And then, of course, as Amanda and Kithri have said as previously, where can it be doing some of the work? I'll give you a personal example. We go through compensation planning. I'm sure many of your organizations do every year. We do it by a spreadsheet. It's a pretty sophisticated one, but we do it by spreadsheet. And my comp leader and I used to spend hours running pivot tables to try and identify, are there any hot spots when it comes to comp in our organization that we need to think about or raise to our CEO? We popped those files into Copilot, and within 5 minutes, we had either red flags or hot spots or things you'd like to look at. And then we sat down and said, do we agree with this? Does this match up with what we see in real life? So instead of spending 3 or 4 hours on pivot tables, Maggie and I would literally divide the file. You do this tab, I'll do that tab. We were able to spend the time really critiquing and validating what the AI output told us. And that's right, but that's Excel. Everybody uses Excel. So I think the more examples we can share of how AI becomes part of the work, not an add-on, the more comfortable folks will get. And invest in those tools. Frankly, Microsoft offers free courses on its website, how to make agents, how to do research, how to craft a visual. So for those organizations who may not have the budget and or the resources, there is a lot of quality content out there, including by the publishers. Claude has it, Microsoft has it. So utilize that, but get people comfortable. They will come back and say, oh my gosh, I saved 4 hours from not having to do pivot tables or look at this or look at that. Give them the wins. And then to Amanda's point, so how are you using that time? I'm actually being more critical of the output, and it's spurring more ideas so I can practice more at the top of my license.
It's great insights, and I wonder if that comes with the background of the professionals in there. Highly educated, lots of learning that had to go in. Feeling like, hey, I don't want to take a shortcut. That's not how I was trained. That's not how I was brought up. It's one of those things that probably needs to, their thinking needs to be shifted. Kithri, would love to hear from you and your organization. And then I also wanted to mention there's a great question in the chat that we'll also get to. Part of it is I can't pronounce the fifth word in there. So Kithri, let's hear from you first.
Sure. I think it goes, I totally agree a lot with what Lisa was saying. It's not necessarily about training people that, how to use the AI, because it comes from how do I use it in my tasks today? So how do I understand how the task that I'm trying to perform can be enhanced or supported through using AI? And so it's almost more like a readiness or an example type problem that I think people they just haven't examined their own work processes in a way that they understand how AI could perhaps support that and make those more efficient and effective for them, and how it can support them. And they're not cheating. It's giving me a place to start, a place, something to react to. But we do also have to help people, and it is a trust thing. It's trust in that we're not going to replace them with AI, but it's also how do they trust the AI, and then understand how then to build upon it. And so making certain that our AI is trained appropriately, and that we are being very secure in how we're using it, and helping them to feel comfortable with that. So understanding a little bit more around how it works, and how there are some ways to check the quality of the things that it's giving to you. So helping them to understand how to put it into their own workflow today, I think is really part of what it is that's going to help us with adoption and all. One of the things that I heard about recently, which was interesting, is that there was some AI that they were trying to put into some processes, but they noticed that when they started looking at some of the data, and they noticed that there was a lot of overrides on what the AI was suggesting. So understanding like why isn't the AI working there as well would be helpful in understanding how do we do a better job of adopting it and allowing it to help us where we want it, and not where we would rather it not give us certain inputs.
David, I just really want to do a double underline of what Kithri just said, because
Absolutely.
this was a game changer for me when I started using AI more regularly. You said it, Kithri, the magic is in, don't think about I have to use AI or I should use AI. What is the task that I'm doing? And can AI help here? I'm analyzing a comp spreadsheet. I need to create a PowerPoint deck. I need to pull out the 5 highlights of this 500-page report. So I think that's so on point, Kithri, that use it to enable the task that you're doing. It's not an add-on, it's an enabler. And even basic things, I don't know if anyone's tried this, but for those folks who are Microsoft shops, in Copilot, your Outlook calendar can help you prep for meetings. And I've actually used it. I've been out of the office. I was out of the office one day this week, and I put in the prompt, what were the 10 most important emails in my inbox? And then I looked at that. I looked at what Copilot came back with. I scanned all the emails, and I agreed with 9 of the 10. So the more that you're using it, the more it gets to know your rhythms and your style and your content, the more you'll be able to trust it. So I couldn't agree with you more, Kithri. That is how I found peace and comfort, that this is really an enabler and a game changer versus, oh, I need to learn this because I don't want to become irrelevant, which that's important too. But more importantly, use it to do real work. You don't have to make stuff up to use AI. It helps you in your everyday work.
Absolutely. You shouldn't go looking for use cases of where you can add on new work. That's not going to help any of us. How can we automate and offload some ideas? And then the question in the chat was talking about workflows like claims and
Yep.
prior authorization, where AI can materially impact member and providers' trust. How do you decide where automation should stop and human judgment step in? And I think even just, Lisa, your comment about the emails, it's a very, very practical example of, I used it. I agreed with 9 of the 10, but I overrode, where I should add my own human judgment into the conversation. Anybody want to tackle that question or
I think that's a good question because I think oftentimes we have to realize with this, we have to have a healthy balance. I think we have to also ensure that people understand that because, especially with all of the different generations we have in the organization, and that's across all industries, several people approach it differently, and our newer generation approach it where it's like they're even talking to AI and asking it questions. And so I think when you look at that question that was asked around how do you decide where automation should stop and human judgment, it's what are the low risk items like the emails and the meeting agendas being, summarized. But when you're out there with patients and you're doing actual clinical work that's impacted and you're really focusing on authorizations and you're focusing in certain areas, you have to, as a leader, make sure you're telling those team members are just across the board, you're setting the standard. What is low risk? What is where AI is very useful? And what are those critical areas where we really need that human judgment? And that's what we're going to continue to live in because oftentimes we can go AI, because that's the new thing. But we also have to have a healthy balance of understanding that we're in patient care and we're always going to have a level of human judgment, especially around more moderate or very critical cases or very critical situations or processes. That way, people understand, oh, I use it in this space because it helps me be more efficient, but I need to think through critically because that's what we have to balance as well, is that we don't lose those critical thinking skills that we're trying to build. Because it's even a joke sometimes from people where they're like, I let Copilot write my emails, and then when I go write an email, it's almost like it's a pause because if you have so many people that will depend on it. And so I think that's where you got to find a healthy professional balance to use it for the right work.
Yeah, I'd add on to that too, because our company does adjudication as well. So thank you for that question. We do it in clinical trials, so not for processing claims, but validating the claims that the pharma companies are making about what their products can do. And it's a very data intensive process. And what I hear from folks in that group, there are certain things that fit the standard, so you know what they are, and that AI can do a pretty good job because AI is picking up on patterns. It's giant crowdsourcing. So it's picking up on patterns. So there's probably certain steps of adjudication that are pretty standard that AI can do the legwork for you. But then you get to some of these nuances or there's 5 different permutations of how a claim can be adjudicated or data can be adjudicated. That's usually where the context and the critical thinking of the humans come in to say, with all these other circumstances, do I agree it's A, or do I agree it's B, or do I override it? So I think there will always be that combination. Basically, know that process, understand that whole process of adjudication, and look at what is standard, repeatable, pretty consistent. And then where do things often require judgment or permutate? That's very likely a clue that that's where you're going to have to use your subject matter experts and practice at the top of your license, like Kithri keeps reminding us. That's, to me, where I've seen those skills really come in and delineate what AI can get you to versus the human taking it across the finish line.
I think what you said too, Lisa, just to add on to that as well, is, it's really good at summarizing or gathering all the data for us and helping us make sense of it. So even Amanda, like when you're talking about, we have to be making those clinical decisions based on our own experience and knowledge. But today we have data where we can see like these therapies have worked for these patients across these different clinics and things. How do we use AI in some ways to maybe validate our own decision making in sort of in the reverse too? Like, this is what I think is the best plan based on my experience and my knowledge. I can look at some of these tools that we have available to us to just see, am I missing something? Can it provide another example? Now, of course, I'm going to use my own best judgment as to whether that's, something I need to adopt here. But it can work in the other way because of the vast amount of data that it has available to it. So it's helping us to expand our thinking, as well as we have to make certain that we're double checking it as well.
All great insights, and I love how each one of your insights played off the other and advanced the conversation. So thank you so much for the conversation. I'm learning a lot. Like I said, I didn't come from the healthcare. That's why I couldn't pronounce adjudication. Had not seen that term previously, so one more term to look up in the dictionary for me. Lisa, I actually wanted to come back to you because you tackled the burnout question. And talk a little bit about another theme that we see in healthcare, and that's workforce shortages. It's not a short-term thing anymore. It's becoming much more of a long-term reality. So what adjustments are you making to how work is structured and delivered?
Part of it, David, goes on to what I shared in the prior example. We're asking each of our people leaders. Our people leaders have such hard jobs, and they're getting more complicated by the day. But we're asking people leaders to really understand the workflow of the team. Like, what is the work? What is the product or the output that is produced? And then trying to understand, do you break that into subtasks and you centralize those? For example, if you look at, I'll give you recruiters on my team. Recruiters currently, they do scheduling, they do phone screens, they do interviewing, they do sourcing. Is that really the best use of their time, frankly, to be doing scheduling? We all know scheduling is just such a bear in recruiting. Or do we centralize that? Or even better, can we use things like Calendly? Some of these tools have been around for a long time. So really understanding the workflow, breaking that work down into what are the outputs and the deliverables, and looking at, number one, what can be automated, what possibly could be outsourced, what could be done differently, maybe by different staff. Because I don't think the workforce shortages are going away. I don't think they ever really did. I work in the life sciences. You just always have shortages of biostatisticians. Anybody? When I recruited for Johnson & Johnson 15 years ago, you were lucky if you had 3 on a candidate slate, and it's still like that. So I think in some areas, we've just lived with talent shortages, and you've had to get creative. You now have a new tool in your toolbox with AI to maybe do some of that work like scheduling or analysis or do pivot tables, which takes the load off of the humans. So you may not have to have as many. And then how do you structure that work? That doesn't solve everything. But the other thing that we also do, we rely on a contingent workforce. We are a study-based business. So studies, they start and they stop. Some studies are 30 days, some studies are 5 years. We can't bring on staff for some of these studies because you're constantly onboarding people and terminating them. So we've leveraged the contingent workforce. And interestingly enough, we've actually found that people like that. They like that flexibility, at least in our space. Some of our scientific experts, they consult on a number of different studies for different clients. So we have found a mix with contingent workers that helps us in triage mode. The one downside, there is some risk of institutional knowledge when you have contingent workforces that are supplementing your workforce. So again, can you use AI to document and capture some of it so you become less dependent? But there hasn't been one thing for us, David. We've had to employ all the usual tricks and then some creative things. But I keep going back to work design. What's the product? What's the output? Does it have to be done the way it is today? And we have new tools available and new types of people with gig workers. Can we use a different mix of how we address some of the shortages? I also would love to 3D print biostatisticians. If anybody has any ideas, please email me on LinkedIn. We are always recruiting for them, and they are by far one of the hardest jobs in healthcare, probably in the world. There's just unfortunately so few of them.
We can't, David, we can't hear you.
Yeah, I think he's on mute.
Sorry about that. I was just saying until we learn how to 3D print those people, would love to hear some feedback. Maybe Amanda, you can go next.
Yeah, I think in this space, we've had to really reframe our thinking. So no longer planning for when the shortages go away, more so planning to operate within them. So redesigning care teams, how that looks, really focusing on expanding roles and career pathways. We undertook job architecture for our entire organization and will be complete in the month of May. So then the year and our fiscal year begins in July, we'll be focused on those career pathways of development because now we have to really think through investing in our internal pipeline because that's really what's going to help to really allow us to keep the talent within and retained within our organization. We've also, one thing we really focused on with our clinicals, especially nursing, is we focused on reducing dependency on contingent labor, where we have really diminished it because we had, after COVID, it was almost like it was too much and other industries understand. And so what we did is look at it from a financial perspective of saying, how can we retain? How can we begin to develop? How can we create internal pathways? And we make it a culture that people really want to stay in. And we've actually seen that happen. Our turnover has tremendously gone down as a system. And so now we're also trending in the right direction in that space. And that wasn't the case a few years ago. And so I think really focusing on what work is needed, what are the roles that we require, and what can be shifted is what we really focused on. And thinking through, it's not about finding more people all the time. It's about really how do we work differently and also how do we build pipelines in our community. Because what's really helped us is the fact that we have reached out and partnered with OKCPS, which is our public school system, and started early. We have partnerships with all of our colleges, and we're getting ready to open a brand new behavioral health center, and we're partnering with Metro Tech schools and making sure that we're thinking strategically, but we have that footprint and brand in the community where we are telling people we want your children to stay here, because oftentimes in Oklahoma City the kids will graduate from high school and then they'll leave the state to go to Dallas or another area. And so we've had to really gather together and think through as leaders in this organization, how do we make this organization the employer of choice, where once they come into our system, they want to stay within our system? We're also launching a Legacy Scholars Program, which is taking our employees and their children and allowing them to say, you are not building just your legacy, it's a family legacy that you can continue on here. And we have multiple people in healthcare. So really thinking strategically around the shortages and not taking them as a challenge, but taking them as an opportunity. And I think that's what helps us to continue to see success in the midst of all of the changes of how we think about roles.
I love that reframe that you did, Amanda. Kithri, would love your feedback on this one as well.
Yeah, so kind of to go back to the beginning of what Amanda was talking about, thinking about it from more of a teams approach. So we have, competencies and skills, but how do we make sure that a team has the right competencies and skills? So if you're working from a place of scarcity, everybody has to be able to function, again, at the top of their license or in their scope of practice, such that they're all working together. And then, how do we safely shift some of those things? Maybe there's some adjacent skills. So, for instance, the example of scheduling came up. So, our front desk or our operators or people like that, could they be helping us, with some of the scheduling and some of those less risky skills and things? So how can we shift the skills where it's appropriate and make certain that each of our teams have the right competencies and that we're supporting them with that new model, whatever that is? And so when we're filling those roles as well, we have to be clear, like, what is it that we need in particular roles, such that our teams work very well, efficiently and effectively and safely, that we can automate or use supporting roles to relieve pressure where we need to. I think those are some of the ways that we're trying to address those areas.
Great insights. And I know that we are coming up against the top of the hour, so we're going to have our closing statement. I would love to hear from each of you, a minute or less, what you're thinking about in the future, looking ahead. What should organizations and people within HR be thinking about for the future? So I guess closing buttons on the conversation. Kithri, why don't you go first?
Sure. So I think one of the things that we're thinking about is that the pace of change and things, how do we make sure that we're better aligned in HR with operations and IT and the leaders in our different businesses and around? How do we have shared outcomes and operate in parallel instead of in what seems to be our silos sometimes when we're thinking about the change and the strategy that we're trying to implement? How do we use AI or other tools to make sure that we are more tightly aligned than I think that we have been in the past, so that our employees are experiencing change, not just change from IT with a systems integration and now an operations process change, but those things are integrated and aligned in a way that makes sense, again, for our busy clinical settings and the different roles and all that people are trying to perform inside of those systems. We need to be operating more tightly aligned in the future.
Kithri, thank you for all of your feedback and insights throughout this conversation. Amanda, would love to get your closing thoughts and outlook to the future.
Yeah, I think the way that organizations will begin to be successful is when they begin to really look at workforce readiness is no longer an HR or people and culture strategy alone. It's an enterprise performance strategy. So here at OU Health, we have 5 domains. We have the people and culture domain, the clinical performance domain, the clinical services and growth, the Oklahoma impact and external relationships, and the resource stewardship. And we build our systems across all 5 domains so that we can really enhance that leadership capability, make sure that our team members are understanding holistically the reason why we're doing everything, which then allows us to really integrate that strategy to continue that speed of execution. We're really focused on accelerated growth and momentum, and you have to be in healthcare. So I think the closing thing for me would really be to get people to understand that if you want to win in this setting and in this day and age of what's happening around us and the rapid pace of things, you really want to make sure every one of those people in culture systems, Oklahoma impact systems, in every single domain, they're all aligned towards the same goal. And that same goal is, are we advancing county CLABSI? Are we increasing engagement? Are we improving patient experience? Are we driving all of the things that really allow us to truly be that provider of choice for the entire organization, holistically, internally, and for the entire state to our external facing patients?
Amanda, thank you so much for your thoughts throughout this conversation. Lisa, let's close it out with you. Final thoughts.
Yeah, I know we're at time, so I'll keep it brief. Stay curious, stay adaptable. There's no lack of access to information on what's going on all around us. It's overwhelming. Use AI to help sort through it, but stay curious, stay adaptable, and you'll stay relevant.
Thank you, Lisa. And thank you for everyone that tuned in to this conversation. At the end, you'll get an opportunity for a survey, and that could also be used as questions to the audience, and we'll route or questions to the panelist. We'll route that to the right person. So feel free to drop any questions you didn't get in during this conversation. We'll be sure to get it to the right person. Thank you all. Had a wonderful time listening to your great stories and insights.
Thank you. Thank you for hosting us. Thanks everybody for joining.
Thank you.
Thank you.